Hi, everybody. Welcome to Macro Social Work Stories. My name's Steve Burkhardt. I'm one of the co-hosts, along with Dr. Gary Jones at Coppin State, and Christy Holmes will be joining us later in the broadcast. We're really happy today to be able to have a conversation about macro social work with Renee White. Renee, in a previous life, probably came from royalty, but describes herself in much more humble ways as simply a humble macro social worker. Of course, there's actually a lot more to Renee's story that we're excited to bring you today. So, Renee, one of the things we'd like to do is for you to tell a little bit about your story about how did you get to where you're doing the important work you're doing. Where did you tell us a little about you, and then let's how that moved on to the story of what you're now doing that's so important for people to hear about.
Well, thank you for having me as well. I am a prodigy. I've had 39 years of social work practice under my belt. I joke that I'm a prodigy. I'm not a prodigy. I'm just an old social worker. And most of my social work career was in Southwest Missouri, in the region and in the community of Joplin, Missouri, although I've done a variety of other things. Most of my social work, got my BSW in 1983, got my MSW in 1994, and an educational doctorate in 2010. Most of my work has centered in Southwest Missouri, mostly getting paid to do direct practice because we're so far away from our head of governance. Our state capital is 4 hours away, and of course, Washington, D.C. is a lifetime away. I've always been interested in macro and really specifically policy practice. But in my little neck of the woods, about 20 years ago, I started serving on little boards of directors and having an interest in making the world a better place by having new nonprofits or best practice nonprofits. From there, I sat at a lot of community tables that looked at data when that kind of became the thing about in our neck of the woods about 10 years ago. We started thinking that really we should be looking at assessment of social problems and social inequities based on logic and not just heartstrings, and
Wow.
really enjoy looking at data as well as looking at process measures and outcome measures. 11 years ago, my sweet community, Joplin, Missouri, was hit by an EF5 tornado. You want me to keep talking about that, Steve?
Yeah,
Or
yeah, please.
okay.
Oh,
So
great.
my little community of Joplin, a town of 50,000, on May 22nd, 2011, we were hit by an EF5 tornado. Eventually, 162 people died from the tornado, and about one third of our community, and it really was the middle swath of our geographic community, was decimated by the tornado, including, I think, 7 of our school systems, school buildings, one hospital. We only had 2 hospitals at the time. Just a devastation of our community. And that's really the work that I shared with you all about is the opportunities for social workers to be involved and really at the leadership level of disaster recovery. We've kind of left it to people that live disaster emergency managers, city planners, those type of people to do the work of long-term disaster recovery. And I had the pleasure and honor to be a volunteer leader in the Joplin recovery for 2.5 years.
Wow. So, you're actually on a cutting, through a tragedy, you're actually on a cutting edge issue that our other co-host, who hopefully will be here a little bit later, Christy Holmes, but she lives in California,
Mm.
where disaster services have now suffered so much because there's been so much, the overwork, the level of demand has been so unending. Um, what do you think are some of the key issues in doing work like that for 2.5 years? What do you think are some of the key issues that we in macro social work and social work in general uh, can take from all that experience? What do you think is important for us to know? Um,
Naivety is a key. I didn't know that, as I said, the tornado was May 22nd. And at the time of the tornado, I was a university professor who had summers off. And so I thought, well, I'll invest in my community for the summer and do what I can. I did not know that disaster recovery work is a marathon. It's not a sprint. And I'm so forever grateful that maybe I didn't know that. This was my first disaster. Since this time, I have gone to a variety of other disaster sites, but let me kind of share what I think social workers could glean from, or what I gleaned from the job.
Wonderful. Yes.
Yeah.
Wonderful.
The goodness of humanity, and I'll probably cry, Dr. Jones and Steve. I get really verklempt when I think about we had people coming from Europe, coming from other continents to help us put our lives back together in Joplin. I mean, the immediate compassion, the immediate delivery of human kindness is just, you think we know it in social work and we think we kind of have a corner on it, but the humanitarian kind benevolence just to this day still brings me. I could tell you stories for weeks about the goodness of people. And so, our community, 50,000 people, was shooken to the core. And of course, we live in the Midwest. And so many people shirked off the idea of having other people help them. But the flood of goodness and kindness that comes in after a large scale disaster is nothing. Go ahead, Steve.
I was going to say, Renee, it might be great. Tell one story that you think might capture what that generosity looked like of people coming, maybe one from somebody inside Joplin, maybe one from somebody who came from outside, and the impact that it had.
Sure. The tornado happened on a Sunday night, and many, many churches were decimated as well. And by the very next Friday, churches who were ideologically kind of in disparate views of what church means were sharing their sanctuary with each other.
Oh, wow.
To me, I know. I mean, within 4 days, people who hadn't spoke to each other, churches, entities who had kind of seen each other as competitors, were breaking bread together, were sharing, including my own church that is a mainline Christian church. And we had the Muslim faith in our church because the mosque had been damaged. So very much ecumenical. I mean, it really does eliminate all the pecking orders. So that's a great story of maybe within our community. My story about people who came and cared for us and served us. First of all, one of the things that maybe many social workers don't know is there is a national model, and it comes from the National VOAD, which is a membership organization that's been around 50 years. And it is anybody that participates as an organization in disasters. And you really don't think about it until you're in a disaster. But one of the things I learned was like the Lutheran Church at the national level has a very specific intervention for disasters. The Southern Baptists have a very specific intervention. And so there is this nice orchestra at the national level of, and I'm speaking of just faith-based organizations. There's a lot of NGOs as well, but they all know the dance. And so when they come to your community, they know their niche. What they look for in your community is what I was the leader of, which is called a long-term recovery group. One of those groups was called Samaritan's Purse. And this is kind of a long story. I'll tell it kind of short.
No, it's good. It's fine.
Oh, okay. So Samaritan's Purse, we always called them the orange shirt people because they all wear orange shirts. And we had a lot of Samaritan Purse people that came through Joplin. And one particular group was 11 guys out of Atlanta, Georgia. And they were there to help rebuild several houses. And I only knew this from the back end. And the back end is every time a house did get rebuilt, the long-term recovery group would have a dedication, a home dedication, and we would typically have the homeowners speak and maybe some other people speak. And so I always went because we had cake and ice cream. Yay, cake and ice cream, good.
Hey,
Anyway,
always freaks people out.
yeah, yeah. Well, it did for me. Now, I really enjoyed having the dedications. It was kind of the pinnacle of the hard work that happened on the back end. But I was at this one home, and the husband, wife, and 2 children were standing in their new kitchen, and they had the microphone. 40 or 50 people are standing in their living room, and the homeowner, the father, he begins to speak about what his life was before the tornado. And he said, I haven't told my children or my wife this, but I was a practicing alcoholic, and we were losing money hand over fist. And my wife and I were thinking about being separated, and there was nothing but tension in our home. And the tornado about put us over the edge. We lost our home. We lost everything. And I thought nothing could ever get better from that. I have to tell you, this is the homeowner speaking,
Yeah.
and he says, I have to tell you about these 11 men that came and started rebuilding my house from Atlanta, Georgia. And every day, part of the home ownership is that they would also participate in building their home. And he said every day at noon, they would break and they would sit themselves in a circle and they would eat lunch and talk. And I always thought, what the heck do they have to talk about that they have to be in a circle? And finally, one day I asked one of the dudes, what are you guys doing? And he said, oh, we're having an AA meeting. We're all recovering alcoholics.
Whoa.
And the homeowner breaks down and begins to cry as he's telling the story with the microphone. And he said, I have to tell you, I joined those men that day 163 days ago. And I have been sober since. And his wife and his kids, they have no idea. And they're crying. And at that very moment, those 11 men came back from Atlanta for the home warming and walked through the doors.
Oh my God.
Steve, I got to tell you,
I mean,
I've
we're
got
cheering up here. I'm
goosebumps
cheering
on
up here.
goosebumps. Yeah, I got goosebumps on goosebumps. And he said, so the guys walked in and he's like, oh, holy cow, you guys are here. And he goes, they did not just give me a home. They gave me a life I never even knew I could live. And there wasn't a dry eye in the room, but that's the kind of work after a disaster. And I think as social workers, we understand kind of breaking through status quo and seeing life bigger than it ever was, but to see humans touching humans doing that, not in a professional way, but just one good guy helping another good guy.
Wow. So, boy, that's thank you for both those stories. They really say a lot, and also that information about it'd be great. Maybe as we go on, you could type it in. I think we have a place to type stuff on the chat where you could put in the name that we could send to that would be available. Not the name, but the email of the group, the VO group. It's very exciting. So, have you been able to bring this into social work curriculum into the school?
So like I said, a year after the tornado, I left academia and went into direct practice on a federal grant with Joplin schools, so our public school system. And so I really did trauma recovery for 4 years with some soft money. When that money ran out, I did jump back into academia. My Joplin, Missouri has a university called Missouri Southern State University, kind of a regional university. And they tapped me as their first BSW chair. So I started a BSW program. Now, inside of that program, we did not have an elective as such about disaster, but it was wrapped through everything that we talked about with trauma. And most of because it's a regional university, I no longer work there, but because it's a regional university, many of the students recall and had touch points to the disaster itself. So very much a part of the storyline in the BSW program there in the town. From that, the university has actually, with my insistence, I founded a Center for Disaster Recovery. So a virtual platform where
Wow.
Missouri Southern State University will become the repository of all knowledge. We were studied a bunch, not obviously mental health, trauma, resiliency, but also how to rebuild hospitals, how to, all of that. So Missouri Southern State University has established this center to be a repository of all new knowledge that was gained from Joplin, hoping to share that with the world as we go forward.
Wow. The world's going to need it, unfortunately. I mean, when I say unfortunately, you know what I mean.
I
that we
do.
have so many more.
Mother
Nature's
Nature is not happy with
He's
us.
not happy at all. Gary, I don't want to, I'm sure you might have something you want to ask, so
yes.
Comment.
As you highlight the collaboration between the faith-based organizations, because many times in social work, we shy away from faith-based organizations, but you talk about the collaboration between different faiths, because in media, politicians kind of have been divisive when it comes to different ethnic groups and faiths, and so that model of collaboration between faith-based and you said they have actual structures and a process they go through. I'm a part of a faith-based also that has ADRA, Adventist Disaster Relief also. And so if a social worker who wants to use their faith in disaster, what kind of resources are out there for that student?
That is a great question. So again, hearkening back to my days of Joplin, we had many chapters from the Jewish Relief Society from different universities come through town. So I know the Jewish student union or student body is very organized, and there's a lot of those other chapters or organizations at universities. But even in your own faith, if you'll look on their national website, if they're affiliated to a national group, it will predominantly show disaster work. We loved people that were already trained in disaster. So we would call things skilled or unskilled. And we really didn't mean like you could hammer a nail skill, but just you had knowledge of what you were walking into. And so that's what's really great, Gary, about connecting with your faith. And if they have an arm called disaster relief, they're going to prep you. And then we would know at the local level what your niche is. Some people did daycare. The Brethren Church is known for childcare. So everybody has like this niche as they come together. And if you as a social worker want to respond to a national disaster, the first thing you want to do is don't drive in on your own unaccompanied. Get an affiliation because otherwise it just messes up the system. But what a remarkable way to experience recovery and healing, and you will come out richer for being there, as well as the community comes out richer for having you there. The other thing is that oftentimes we're compelled to send something, to donate. And my first experience really was Katrina. Hurricane Katrina happened in 2005. And it actually happened the first day I was an academic professor. And I felt compelled. Our NASW code, chapter 5 is what I call it, but the 5th section says, you will respond to national disasters. And I was like, oh my gosh, I got a 5-year-old and an 8-year-old at home. I can't go. And so myself and the students, we were compelled to want to do something to send. And that's a really good, I know I've digressed a little bit, but do not send your teddy bears. Do not send socks. Do not send bottled waters. Cash is king. Cash is really the most beneficial thing to send a disaster impacted community. We kind of call it a second disaster when you have so much inventory that volunteers are now placed at resource centers to inventory the teddy bears, the t-shirts, and it just clogs up the system. So I love that people are compelled to do something. I would really encourage you to have a garage sale with all your good stuff, and then send that money. And again, I'm on a pitch, so send it to the long-term recovery group at that community. And again, that's that national model that I worked under, and I will send you more information. But that is 100% of that money goes to disaster affected people. There's not overhead. Many of the philanthropic places that you can, charities that you can send funding or send your donations to, they may have overhead. And so perhaps not all of your money is given or benefiting the disaster affected person.
But obviously that is, boy, that's wonderful. There's so many interesting things you said, like don't send teddy bears. Like a lot of people want to send stuff. And the idea of do a garage sale within your neighborhood where the people know they're buying for the disaster out in Joplin or wherever it might be. What a wonderful idea. So there are a lot of those little nuggets here that are of great value. Was there, was there any pushback in schools, like there wasn't enough time or we have enough whether we're doing, was there any difficulty at all? Was there any, were people completely receptive, which of course would be wonderful?
So Steve, if you mean my work with the public school system post tornado,
public school, and then social work itself, if there was, I mean, I would imagine people both liked it, but also, maybe, I don't know, gets in the way of other curriculum. I don't know.
The public school system was very conducive to doing trauma recovery work because probably about 40% of the teachers also had experienced the disaster. And we estimated any kiddo that lived in Joplin had experienced the disaster. It wasn't just about, was your house damaged? It was the place I got married was destroyed. The place that I always ate lunch was destroyed. I mean, life just took on a new meaning. So my work with the public school, that direct social work practice, was very well received. Inside of the academic curriculum for BSWs, MSWs, I don't know that has been well thought out. And I probably am not the only social worker that was deep in disaster recovery. Like I said, my opportunity at the regional university was to share stories inside of the context of other large curriculum pieces, trauma, good old, crisis intervention. Here's a crisis intervention event that you may never want to experience, but might happen, those type of things.
Well, it's actually a great way to do it, to weave it in as opposed to just, that is for everybody gets it as opposed to, those who take a particular course. So you also mentioned both with the trauma, but also resilience in the building back stronger. One of the things that sometimes in my experience, I find we do a lot in social work. There's a lot of time spent on the trauma side. Not that one shouldn't spend time on it. I'm not saying one shouldn't spend time on it. We don't spend an equal amount of time on the healing and resilience that has emerged, the lessons from that. So I was wondering if you could talk a little bit about, I mean, obviously the healing that took place in your stories is amazing. But what's required for the healing in a community to occur, or for resilience to be recreated or refound for individuals after a disaster? What are some of the key elements that you and your team found to be really of real value here?
Well, that's a great question. ACEs had come out just previously before our disaster in 2011. So now I'm reflecting 11 years later. So there's, a decade there that's, but I think, so I'm not sure that we were guided by science as much as guided by what's the next right thing to do. And so I'd like to highlight a few things. One is just normalize the disaster in terms of it's going to be talked about. It's going to be talked about. My kids eventually told me to turn off the TV. They were like, Mom, it's too much. And so I think and I really have a direct practitioner. I've mostly been with children. So that's kind of my direct practice hat. But even at the macro practice hat is acknowledging rituals and ceremonies. We had a 6-month citywide ceremony. We had a 1-year ceremony. We had lots of places to touch points to ask, how you doing? How you doing? The hospital that actually was destroyed was a Mercy hospital. And I always give them credit for this. They put out buttons that everybody wore around, and it said, how's your 5? And they said, basically, there's 5 things that have to happen every day in your life to get to resiliency or get to stability. And so it was play, eat, love, sleep, work. I had to think for a minute, that last one. Anyway, that was again, bringing it down to that the whole community is moving in the same direction and that we're all feeling the rumblings. Of course, then also having the credentialed professionals for the outliers. And so we had, as a part of my work at the macro level, is I had national hospice that wanted to come in and do support groups. And I had national KU, Kansas University is not far away. They wanted to come in and do some work. And so storyboards is what they called it. So kiddos did their stories about the disaster. We had a celebration the third Thursday of every month in Joplin. Pre-tornado was kind of a street fair carnival thing downtown. And so after tornado, we made sure that the third Thursday events had some touch points about the disaster. So an example was, under my leadership, we got a bunch of Legos donated, and we had big tables sitting out, and we asked kids to create their community again with those Legos. And so they built hospitals and schools and trees and parks. We kept those intact. We also then had those big old refrigerator boxes and those kind of things, and used a whole city block. We let them paint on the boxes, and then they could move the boxes. So should the hospital be next to the school? We had a lot of fun with that type of activity.
Wow, that's wonderful.
Yeah, a lot of community engagement that I see that emerge as a result of this disaster, normalizing it, and having across the lifespan, having the young people involved, because many times we forget about their needs. And so we can see how the community engagement worked across the lifespan with our young people, because they are dealing with it too. They have lost too. They may not have memories of marriage, but they have memories of the playgrounds, of the schools, the elementaries experiences. And so we can glean from the community engagement that your community, as you share your story, that your community involve individuals across the lifespan in that process. So as emerging social workers, we can see how theory has been placed, how everyone across the lifespan is valued, and their voice has to be utilized in that process. And having boxes designed and having them make decisions it can be critical in their development, in that process. You mentioned about touch points and normalizing this experience. Many times as we work in crises, many times we try to move past what we're going through rather than dealing with the pain or dealing with reality. What are some suggestions that you have for those who want to do community engagement and want to move past rather than just staying right now in what we're dealing with, the pain that we're dealing with?
I love that, Dr. Jones. I love that. Slow down and let people be. Ram Dass said, be here now. That's kind of one of my things is it is what it is. And I did have some pushback at times from the city or some other people that thought, people don't want to read the 161 names of the deceased anymore. We actually still have a marathon that's ran on around May 22nd. And the flags, there's a flag for every person that died. And so in my own sweet way of doing things, I was like, well, that's good. You don't have to come. It's okay. You don't have to come. I don't know. Is that tacky.
That's perfect.
But
Perfect.
yeah, but you know what? One size doesn't fit all, and we'll know when we're done. So we did have a 10-year anniversary last May of 2021, and it was a smaller crowd. And at this point, we're talking about how things have changed. We're not reading the 162 names anymore. But we still remember that there was loss and death. It's not all, rainbows and unicorns. It's
Yeah.
because of the significance of this, we honor those people. We remember them, but we no longer have to do all of the grief work, collective grief work. But very important to ask people to do that grief work. A couple things that we did is under this model that we used with the national VOAD that I've mentioned is what they call disaster case managers. So there is a niche of people who do case management specific to disasters, and they typically are housed in the same office. We put some friendly listeners into the lobby of that office with a coffee pot, and we just said, anybody that has been impacted by the disaster needs to tell their story. And we know in trauma work, they have to tell it until they're done. They have to tell you what exactly they were doing and what they were wearing, and then they'll be done someday. And we know then the trauma is not as significant. So that was an example. We put friendly listeners is what I'd call them. We trained them, just barely trained them on disaster recovery, crisis management. If somebody's not blinking, you need to worry about them. If somebody is getting overly excited, blah, blah, blah. But those people were at our swimming pools, at the senior citizen centers, as you talked about the lifespan, Dr. Jones. We wanted to cover any place that we could have a friendly listener, and they didn't even have to look like anybody but us, just somebody having a cup of coffee.
Yeah. Wow. That's so many powerful stories. I mean, and examples. I mean, you're, as I said at the outset, you're very modest about what are these wonderful lessons that are so important.
Thank you.
What's Joplin like now as a community compared to 13 years ago? I said 13 on purpose.
Thank you, Steve. It's really a pretty groovy town. I no longer live there, but I do. My son lives there, and so I was there 4 days ago. Joplin. The three things I would really love to say is one is the nonprofits, the social service fabric is a very tight fabric, and it used to not be. So prior to the disaster, there was competition of dollars, competition of employees, competition of who's the, coolest thing since ice cream. And since this long-term recovery model that I chaired, and it wasn't about me, but it was the models insisted that you sat at the table with no skin in the game personally or no skin in the game for your organization to benefit. It was truly, truly, truly the prettiest kind of community table I've ever seen. So the social services are very, very tight still. They have a grant writing group that they still collaboratively write grants together that I started. And then, so that's really, for me, that I could say, I could end there and tell you that social services is solid. And people are talking and collaborating, which is huge. The second thing is we received a medical school in town about 5 years ago, an osteopathic school out of Kansas City, which is about 2.5 hours north of us. They brought a satellite campus to Joplin. And so the invigoration of knowledge, of research, I was still at the university when they first came to town, and we did some collaborative research around stress. And so kind of cool stuff to have more cutting edge things going on in Joplin. We are starting a dental school as well. UMKC, University of Missouri at Kansas City, is bringing a dental school. So Joplin is on the map in those types of ways. Geographically or environmentally, there are still pockets that you drive through and you say that was a tornado area. So not everything has recovered. Not everything has gone as planned. Joplin, the city proper, had hired a master developer, and that didn't go well. It's been in the news. Years ago, but the person swindled us out of a couple $1 million, and so that set the city back in terms of infrastructure, new parks, new sidewalks, amenities. They had some great ideas, but that experience with the master developer really soured a lot of things.
Understandably. Well, before we wrap up, we almost want you to have the last word. Gary, is there anything else you'd like to ask or comment on this terrific conversation with Renee?
Yes, we learned so much. We gleaned so much from the lived experience of you and your colleagues there. But the fact that organizations are working together and not competing. I can't say that enough. Together, rather than competing, coming together with grants and coming together, putting friendly listeners to hear just basic stuff that we don't do across our nation. And how far can we really go if we came together as a team? Nelson Mandela always told me, a quote that that I remember: if you want to go far, go by yourself. But if you want to have impact, you got to have a team. And so because of the team approach and collaboration, you all have an impact. And so we thank you for the work that you and your colleagues are doing there, setting pace, because we know that disasters will come, but the model of collaboration, unity, can be utilized to bring about desired sustainable change, transformational change that we know that macro social workers do. So thank you for your story.
Well, thank you, Gary. And the word unity, absolutely. That word is like exactly what it takes. So thank you for your words. And Steve, thank you for having me. I want to say quickly, 5 years after the disaster, I helped found a national group called the Disaster Leadership Team. And we are now mentors to any other disaster community. So currently I'm working with the Western Kentucky's, the people that had the tornado December 10th. I will mentor them on this model. I've been out to the Camp Fire, which was Paradise, California. That was kind of a big event with the fires. Been to Hurricane Harvey, Hurricane Michael. Not trying to speak just on myself, but there's a cadre of about 10 of us that are mentors. We were not all social workers. I'm the only social worker. Most of them are emergency managers, but we are willing to share our experience with the next community and to get their legs out up under them to do these beautiful things that communities experience after disasters.
Thank you so much. We have royalty out there in southern Missouri. I think the queen of long-term disaster planning is Renee White. So thank you for, as Gary said, an inspiring model of what we all need to do in social work.
Thank you all. I will drop you a couple of the websites that I discussed.
Thank you.
And we'll place those in our the video. The video will be on YouTube. And so we'll share the different organizations and links and interventions utilized so that others can hear the story, utilize the methods that we utilize that are can bring about change and work that we do. And we will, and I'm in academia, so we'll talk about what we can do to have more social workers look at emergency preparedness as for training. So thank you.
Yes, please. Blessings to both of you guys for doing this. I think macro social work is where it's at, but we do what we do.
We do what we do.
Yes. Thank everyone for turning into macro social work stories, and we'll see you at our next video.